Wearables are going to slowly change how we practice dental sleep medicine, kind of like your Apple Watch. And here's why. The core idea is not going to change. The patients will be diagnosed with sleep apnea. We'll fabricate an oral appliance. We'll test for its effectiveness, and then we'll manage the patient over time. But now we'll just have more data. And one example is the ProSomnus sleep technologies. Basically, they've come out with monitoring oral appliance that can collect the patient's pulse rate and their oxygen saturation while the patient is wearing the appliance. There's other technologies that are working on sleep position and the night-to-night variability that can be kind of tricky obstacles in monitoring our patients. What interests me the most is just having more objective data to support and guide our treatment decisions, which ultimately should lead to better outcomes for our patients. Traditionally, a lot of our follow-ups with patients have sounded like more, are you wearing your appliance? Are you sleeping better? Overall, how do you feel? How's your energy? Let's wear a pulse ox. Now it's time for a sleep study. And all of that still matters, and the patient's subjective feedback is critically important. But imagine those same conversations with more objective data that we can use to communicate better with patients. It's just simply more depth and a higher level of care. And this feels like oral appliances are moving more towards what our physician colleagues had with CPAP for years, and that's more visibility into what happens after the patient goes home and monitoring their patients. So I'm grateful for all the people investing their time and resources into advancing the dental sleep medicine field, and I'm excited to see how this continues to evolve over the next couple of years.